she has to do the videoing, remember?
She does.
Antimicrobial resistance is a worldwide problem in hospitals and in the community. Antimicrobial resistance is increasing as people misuse antimicrobials. Several communicable diseases have become resistant to standard drug therapy, such as viral infections including HIV and influenza, parasitic infections including malaria, bacterial infections including staphylococcal infections, tuberculosis, and gonorrhea, fungal infections including candida infections. When Alexander Fleming first discovered penicillin in 1928, it was able to kill almost all forms of bacteria. Due to the long misuse and overuse of the drug today, it can only be used to treat dental infections in America. Antimicrobial resistance is defined as the ability of microorganisms to grow in the presence of a chemical or drug that would normally kill it or inhibit their growth. Education is important in the fight against antimicrobial resistance. Mutations in the microorganism's DNA result in antimicrobial resistance. Microorganisms withstand attacks. Standard treatment becomes ineffective. Infections may continue to spread as a result. Hospital-acquired infections are commonly caused by resistant microorganisms. The most adaptable organisms on Earth are thought to be bacteria. Microorganisms multiply frequently and spread quickly. When microorganisms withstand the attack of antimicrobial medication, they can pass on their resistance to their offspring. This resistance makes the use of antimicrobial treatment useless. The infection can spread to other people, causing casualties. It could also lead to an epidemic. Many hospital-acquired infections are caused by resistant organisms. Society contributes to the problem of antimicrobial resistance. Infections are transmitted easily and more commonly with the ease of air travel. Inappropriate use of antimicrobial medication by patients increase antimicrobial resistance. Patients pressure doctors for antimicrobial medications even if they are not needed. Patients stop taking course of antimicrobial once they feel better. Another cause of antimicrobial resistance is the use of antibiotics in livestock. Ranchers use antibiotics to help their livestock grow. An alarming statistic is the fact that in the United States, more than 50% of antibiotics are produced for agricultural purposes. Antibiotics have been helpful to society when prescribed correctly and taken as prescribed. But because these medications have been used for so many years and by so many people, the bacteria they use to kill have mutated, and the antibiotics have become less effective. The same thing has happened to many viruses, parasites, and fungi. There is a greater potential for the spread of the resistant microorganisms because the lack of effective treatment makes people contagious for a longer period of time. The problem is compounded by a lack of adequate commitment by nations to a comprehension and coordinated response. Also, a lack of surveillance and system to monitor use of antimicrobials. Education helps reduce the antimicrobial resistance. Use of antimicrobials should focus on patient outcome and antimicrobial resistance. Patients should be educated when antimicrobial medications should be used and when they would be ineffective. Patients also need to learn to take medications exactly as prescribed by their doctor. Another way to prevent antimicrobial resistance is to prevent infections in the first place. Infections can be prevented by healthy living. Frequent hand washing or use of hand sanitizer can help prevent the spread of infections. Since the development of antimicrobial medications, antimicrobial resistance has become a problem in and out of hospitals. Antimicrobial resistance is very expensive. In the U.S. alone, $20 billion a year is spent on excess healthcare costs. Another $35 billion is spent on other societal costs. As a result, people spend an additional $8 million days in the hospital. The fight against antimicrobial resistance requires cooperation between patients and doctors. One of the most important weapons in the fight against antimicrobial resistance is education.